Hello, everyone. We're glad you're here and joining us. We're going to get started momentarily, so just bear with us. Glad to see so many nice faces on. Hi, everyone. I see you, Mr. Ely. How are you?
Unbelievable.
That's great. I like that saying. Good job. Wonderful, wonderful, wonderful. Welcome to our University of Houston Preview Day to everyone on. We are so glad to have you today.
Hey, Kisa. Hey, Morgan.
Hello, everyone. Look at all the nice, wonderful faces. Hello, everyone. I'm like, oh, like 1 minute till showtime. So everyone that's on, thank you for being here. Thank you for your timeliness. Wonderful. Are you doing okay, Dr. Celine?
Yes, I am. Much better.
That's awesome. When you said you were under the weather, I was like, so, me too. It was something about last week. I was in the hospital for a few days.
Oh, you were in the hospital.
I'm just glad to be back. Glad to be in the building. So when I was like, it's something going around. One of our fellows was telling me that one of the speakers last week had an allergic reaction during her presentation and they had to rush her to the hospital. Like, what is going on?
Oh, man. Well, I had C problems, so I had COVID.
I'm glad you look very good.
Thank you.
Hi, Ms. Owens. How are you?
Hello, I'm doing well. I almost said good morning, but we're beyond morning.
Good afternoon.
Well, thank you.
Well, it's 5:30, so it is the afternoon. I checked just to be sure, because when you said morning too, I had to look. Yeah. It is 5:30 p.m. And so we welcome you all to our 2022 Spring Preview Day. It's a bit of an open house virtually, but we are glad to have so many people that are on today. And we're happy to showcase our college. We're happy to be able to tell you about our program. My name is Nikisa Sapp. I am the Director of Pharmacy Recruiting for our College of Pharmacy. And I see our wonderful staff members that are here, and I'll let them say a nice hello so you'll know our department and you'll know and be familiar with our Student Services office here at the University of Houston College of Pharmacy. So before we get started, we're just happy to have you, but let's meet some of the team from Student Services. And I see Mr. Martinez. Go ahead, Mr. Martinez, introduce yourself for us.
All right, good afternoon, everyone. I smiled because I almost made a mute/unmute mistake there, but I did not. So good afternoon, everyone. Nice to have you all here. Again, James Martinez, I work as the admissions counselor here in the College of Pharmacy. So I've worked with many of you as far as choosing courses and all kind of fun stuff as you prepare to apply for pharmacy school. So welcome. We look forward to having you all today.
And I'm sure a lot of them know you already, which is how they know or knew to come to this event this evening. Hi, Mr. Ely. Oh, how are you?
Good afternoon, Mrs. Sapp. I'm doing great. My name is Morgan Ely. I'm the Director of Pharmacy Admissions here for the PharmView program. So I work with this amazing team to help process your applications, get them ready for committee review so the admissions committee can say, yes, this person's awesome. Let's get them in for interview. And then after the interview day is over, I make sure everything is correct so the committee can say, awesome, let's get this person accepted as quick as possible. So that's my role, and we're excited to have you all here today.
Thank you, Mr. Ely. And Ms. Owens, hi.
Hi again, everyone. I am Shauna Owens. I am the Director of Pharmacy Student Services. Where you would see me within my role is once you're admitted into the program, I am one of the advisors to the pharmacy students. So in my role, I work real closely and kind of monitoring grades, making sure you're successful academically, and also working on putting together a plan for academic student success, making sure that you are progressing nicely, as well as we have tutoring services that are free to all of our students, and we have workshops that we work on time management, as well as study strategies and other skills. So welcome, and thank you for joining us this evening.
Awesome. Now this was introductions by the student services team. We also have some very important other individuals, and you are going to meet them momentarily. Our wonderful faculty members, and I'm about to introduce our dean, and we'll have a student panel a little later. But again, like I said, for those of you that have just joined, we are really excited to have you here this evening because we want to showcase how wonderful our program is. I think everyone already here involved, whether it's staff, student, or faculty, we know how great the program is, but we want to let you know how great our program is, how we are a Pharmally, and we're going to do that in a number of ways today. So before the end of our event, you will have met with our students, and we're going to have a student panel a little later. We're going to have a faculty spotlight feature, and you'll hear a little bit about a faculty member's role and her specialty. And then we'll talk about some information specifically related to our admissions program and status. And we're just really excited to share all of these things with you today. So let's get started with our event today. And the person that I'd like to next introduce is our dean, Dr. Pritchard, Dean Pritchard. And so he is definitely a wingman when it comes to UHCOP, because once he talks about our program, he makes me want to go to pharmacy school, and I'm not a pharmacist. And so I'm going to introduce Dr. Pritchard, and he'll tell you a little bit about our program and just welcome you this evening, and we'll share with just a nice time. So good evening, Dean Pritchard. How are you this evening?
I'm great, Nikisa, and it's my pleasure to join you guys tonight for our open house event. And this should be a wonderful opportunity to showcase our great program for our future potential students. And we're so glad that everyone was able to join us, and can't wait till you can actually visit us in person. Because as good as this program will be tonight, the in-person tour will be that much better. So we look forward to the possibility of you guys visiting us in person in the near future as well. And Nikisa, I want to say that it's wonderful to see so many of our great staff and faculty joining us tonight. This is a great opportunity for our students to get to know our team a little better. And to see the passion and the love for the college, the profession, the university that everyone has. And you've chosen a great program to take a closer look at. In fact, our program has been #1 in the state of Texas for several years in a row from a national board pass rate. And that's, as you know, very important. And after you finish your clinical training, that takes 4 dedicated years, you don't want to miss a beat, and you're ready to go out and help your communities and help your patients. And by passing the boards, you don't miss a step. Unfortunately, some students across the country don't pass the boards, and that's never a good scenario. So you've chosen the right program to take a look at and to hopefully join, and we look forward to that. Along with our great pass rates, our faculty and staff have done a great job in growing our research program over the past several years. We keep moving up into the rankings, and currently we're up in the top echelon of programs nationally from a research program, and you'll hear much more about that probably a little later. But 2 of our faculty members have actually developed great therapeutics to help with our current COVID situation. And we're hoping that those discoveries continue moving along the continuum and may be available to help patients all around the world prevent the horrible effects of this COVID pandemic that we've been involved with in recent years. We're also, as you know, a member of the world's largest medical center. It's 10 minutes down the street from us. And in fact, our entire university is a member of the Texas Medical Center. So technically our campus is part of the Texas Medical Center, but our College of Pharmacy has been a member since 1980. We were among the first of the institutions to be inducted into the Texas Medical Center. We're very proud of that. But you're going to have a great evening tonight. You'll see a lot of great things, and please ask questions. We're here for you. And I hope to see you all very soon in matriculating into our program and becoming great clinical pharmacists and doing wonderful things for your communities. So welcome, and I look forward to, again, seeing each and every one of you very soon. Take care.
Thank you, Dean Pritchard. That was such a nice introduction and welcome. Yes, and we are very excited to have you. And so moving on with our program today, the first speaker for today was going to be a faculty member. And there's a saying, or I'm sure you've heard this saying, and I might get it wrong, so forgive me, but there's that saying that says, those that can do, those that can't teach. So that might be an okay saying, and that might be fine and well, but guess what? The faculty members at University of Houston College of Pharmacy, not only do, they teach too. So our faculty, they can do both. And so the next person I'm about to introduce is none other than a wonderful faculty member that does and teaches as well. So I wanted to have a speaker tell you a little bit about their role in terms of what it's like to be a faculty member here, but also what her pathway was to the College of Pharmacy, to the profession, and then just that day-to-day, like expectations from a faculty member, expectations as a professional. And so it's really good to hear from someone who's already there, because obviously none of you all would be here today if you weren't trying to get there too. And so that's why we have a wonderful faculty speaker spotlight feature. So without further ado, I am introducing Dr. Onye Ohanobu. Oh, I'm sorry if I say it incorrectly, Ohanobu. And she's going to talk about her role in the College of Pharmacy and then all the wonderful talent and experience that she brings to the College of Pharmacy. So I am so sorry I said your name incorrectly.
It's okay. It's okay. We're still here. We're okay. All right. Can I share my screen? I'm pretty visual, so I just put up a couple slides for you guys to follow along with me as I speak. So I'll go ahead and share that now. All right. Can you see the screen there?
Yes, we see it.
All right, let me go ahead and put the slideshow and let me know if you see okay. Do you see the presenter's view or the regular view?
We see your presenter view. So we see your screen and then you're talking. Yes, we see you as well.
It looks perfect.
Okay, perfect. Okay. All right. Really excited to be here. I remember when I was a pre-pharmacy student and I didn't know what to do, where to go. And so I'm really excited and grateful for University of Houston that they're so passionate about speaking to you all, especially on this day. So without further ado, I'll go ahead and start. So this talk is going to be pretty much about my career path and pretty much how I got here, and then also maybe some tools for you guys to have, to kind of learn more about pharmacy as well. All right, so we're going to start off. So I started out at the University of Connecticut, very, very, I know I'm here at U of H, but I'm a Husky at heart. So, basketball, March Madness just, finished. And so we didn't go too far for the men, but the women did a great job. They lost, but, I'm very, very, very proud of University of Connecticut. But I started there and got a bachelor's of Allied Health and Diagnostic Sciences when I was there. I really, really enjoyed undergraduate. I knew from the beginning that I wanted to be a pharmacist. So that's something a little bit different about me. So as a senior in high school, I did a pre-pharmacy there was an informational my brother went to, and I went with him, and I was like, yeah, this is where I'm going to be. So I kind of knew already in the beginning that I wanted to be a pharmacist. And so as I went to the University of Connecticut, I had that in mind. So I did a little bit of research there, like a student research with some professors there, just to kind of get my feet wet in there. And then what's unfortunate is I applied to pharmacy school And guess what? I didn't get in. So not a lot of people know that, but I didn't get in at all. I applied to 14 pharmacy schools and I did not get in. And so I took a year off and I worked at a clinic, a health clinic called Cornell Scott Hill Health Center. And what I did there, I was a drug treatment advocate. And so my role was to help HIV patients, oh, sorry, not HIV patients, injection drug users, facilitate them into a rehab type center to help them be clean. And then that prevents HIV risky behavior. So it was an HIV clinic that I worked in. And that was the moment where I said, you know what, now I found my purpose. So now when I apply to pharmacy school again, I know that I want to focus on HIV. The clinic was amazing. And in my mind, I just kept saying, you know, what they need here is a pharmacist. So I applied to pharmacy school again. And I got into many schools this time. Now I had a new application. I was well-rounded. And I decided to go to the University of the Incarnate Word in San Antonio. While I was there, I also got involved. I was one of those students that was very, I was excited to be there. I mean, I knew I wanted to do this, right? So I got involved. I got involved in pharmacy organizations. I did HIV related projects. And, you know, I really knew like that I'm going to be a specialist. So the next step after pharmacy school usually is a job, or you can do a residency. And nowadays there's so many things you can do. You can do a fellowship. So I decided to go ahead and do a residency. So I did my residency at Howard University Hospital, where I kind of learned more hands-on training as a pharmacist. And so I did that training 1 year in a hospital. And then after that, I went on to go get a job at MedStar Washington Hospital Center. And that's where I kind of started getting more into what my specialty is now. So as I'm talking to you guys, I'm telling you guys, I really was interested in HIV. I thought that was going to be my pathway. But once I got to my residency, everything changed. I did one rotation in cancer medication. Oncology is what we call it. And I just fell in love. So I pivoted that way. So that's another thought, that you don't always have to have everything set that you want to do. I mean, things change, but it's good to kind of have, you know, keep your mind open and options open as well. Then in 2016, I transitioned from Washington, D.C. to Houston. My husband was here, I got married. And so we decided to move here. So around that same time, I started a nonprofit organization called Pharmacy Initiative Leaders. We'll get into more of it later on in the presentation, but it's a nonprofit organization that really seeks to help students, pharmacy students, kind of land their post-doc training. So residencies or fellowships. We do like CV review, mock interviewing, case review. And so it was an organization that stemmed from, you know, me and the other 3 founders not really having guidance on our way. I also then started working again in inpatient oncology. And then I did that for a couple of years from 2016 to now. And so not too long ago in February 2021, I started my role here at the University of Houston as a research professor. And so my research focus is in health disparities in oncology patients or hematology patients. And so I still do have a clinical practice site. And so when a lot of people hear research, they think of the lab, and that's also a part of research, but my research is a little bit unique. My research is in my clinic, my practice site. So I see patients and my research questions come from me being in the clinic. So it's a very interesting role there, but I really love it. So what is a hematology oncology clinical pharmacist? Like, what do we do as a, you know, in this realm? So as a pharmacist in the hospital setting, my role is to make sure that I'm kind of bridging the gap for our patients, as well as the healthcare practitioners, the physicians. I get involved with treatment dosing, making sure that our patients that are getting chemo are getting the right medication, the right dosing. We are pharmacists, so we are the drug experts. So the physicians look to us to make sure that we are helping with, you know, drug information questions or things that they may not know on the medication side. I don't know if a lot of you all know this, but in medical school, a lot of them have like 1 semester or 2 semesters of pharmacology, whereas pharmacy school, we have entire 4 years of pharmacology. So we know we're the experts in medication. I'm also responsible for making sure and ensuring safety through medication and symptom management. So if our patients are having some type of issues, maybe high blood pressure or maybe a rash or something, we can kind of fine comb and figure out what's going on. Like, is it this medication? Is it, the dose? Is the patient's kidney working well? A lot of medications go through the kidney. So that's what that's what I do kind of on a day-to-day, just kind of making sure that all the patients are okay. Now on the academia side, I also teach. So as Nikisa was saying, I also teach in the oncology module or in the oncology class. And so I teach different types of cancers to the students. And I'm also doing research year round. So I'm conducting research in my research areas and my research focus areas, which is health disparities. I'm very interested in leukemias and sickle cell. So that's, what a day-to-day kind of looks like for a clinical pharmacist and in academia. We're also team collaborators. So just because we're a pharmacist doesn't mean that, we just, stick to the pharmacy department. We work with physicians, nurses, social workers, case managers, and you just have to be able to build that rapport with the team. I mean, that's very important when it comes to our profession. It's not only just, siloed in just as pharmacists hanging out with pharmacists. So we have a lot of team members that we work with, and they really do look to us for drug information questions. Another part of my role is also mentorship. So I mentor students and residents. Mentorship also looks, we also call it preceptorship. And so when a student comes with me on rotation at my practice site in the hospital, I'm helping them learn about the different cancers and disease states. And so it's really, I really love doing that because I feel like when I was a student, I loved my professors that really poured into me as well. And then going back to the Pharmacy Initiative Leaders I was telling you guys about earlier, my nonprofit organization, this organization is super important to me. It's something that I'm very passionate about. I truly believe in diversity in the healthcare field. That's because there's a lot of patients that are out there that, need that diverse touch. If you've never been in the shoes of one of your patients, how will you be able to take care of that patient? For example, sickle cell patients have a lot of pain because of the disease state and what happens, through that process. Now, if you've never had sickle cell and you don't know what that pain feels like, how would you be able to take care of that patient? Or if you've never learned about the patients or kind of sat down and interviewed a patient, how would you know? And so that's something that I'm very passionate about. I would like to spread that diversity. And that's what we're trying to do through Pharmacy Initiative Leader. We're starting with pharmacy school, but eventually the plan is to branch off and just kind of, allow other healthcare professionals to kind of, use us as a resource to kind of educate on that. As I talked about before, my research interests have to do in health disparities, and that is in 4 domains. So patient safety and effectiveness, gaps in care, like patients that may not have access to care or may not have insurance, but they need help, or they may not have a car and can't get to their appointments. So those are some of the areas that I'm interested in. Quality improvement. For example, if you come to the hospital and patient needs chemotherapy, but the patient gets to the hospital at 8 a.m., but they don't get their chemo until 9 p.m., that's not good, right? So they've just been sitting in the hospital for almost 12 hours. So I'm interested in quality improvement and kind of process improvement as well. And then, of course, as I just spoke about with my nonprofit, increased diversity and inclusion. Some of my research projects over the years, starting even from undergrad, was medication adherence in HIV injection drug users, health literacy and readability. So in San Antonio, when I was in pharmacy school, the reading level was 6th grade. So the reading level is 6th grade, but all the patient discharge pamphlets are college level reading. How are the patients supposed to understand, how to go home and take their medication if they can't even read the pamphlet? So I did some research on that. Medication reconciliation. So when I was a resident, one of my major projects was to make sure that when patients come into the hospital through the ER or are admitted outside of the ER, there should be a pharmacist or a nurse or a physician or someone that goes through the patient's medication list to make sure that when they get into the hospital, they're starting, critical medications like high blood pressure medications, and not starting the non-critical, like maybe a vitamin or something. We don't necessarily need that for acute or for, immediate issues. So that was another project there. Quality improvement, as I talked about, the chemotherapy delays, and then medication adherence in oral anti-cancer therapy. So we're looking at breast cancer patients and looking at if they're taking their medication appropriately. There's a lot of delays or non-adherence, not taking the medications. There could be so many different barriers. It could be maybe the lack of education, or sometimes, these patients don't feel any pain, they don't feel any issues. They're like, well, why should I take this medication every day if I feel fine? So just education on the importance of it. Maybe there's some side effects. Maybe the patients are feeling hot flashes or something, and they just like, I don't want to take this medication anymore. So we're doing research on that as well. The similarities with all of these projects, once again, is the health disparities. So that's my research interest, and those are some of the projects I've done over the years. Some of the current research I'm working on is looking at the microbiome, which is bacteria in your stomach, in the gut, and see what effects it has on pain crisis in sickle cell patients. I'm also looking into the high dose AML therapy and what are the outcomes of our patients here at the county hospital. What does literature say is a good response rate to some of this chemotherapy versus what our patients at the low income patients or indigent patients, underrepresented patients experience versus what the literature says, which are not in those patient populations. And then medication adherence in multiple myeloma patients taking immunomodulators. So once again, it's just medication adherence. Are they taking the medication the right way? And then lastly, this is a book that I read as a pre-pharmacy student. It was the most amazing book I've ever, I think it's what solidified me that like, I'm definitely going to be a pharmacist, because all I ever knew about pharmacy was retail, like Walgreens, CVS. I didn't even really know too much about the hospital. I didn't know too much about industry, like working for pharma, big pharma companies. But outside of those three, even academia, outside of all these things, there's so many different areas. There's tech. I have colleagues that work with Google in healthcare. I have friends that work in companies that are doing artificial intelligence, because anywhere there's medication or anywhere there's any type of pharmacy related anything, we can do it. So for example, I have a friend that works in marketing. Who is better to market a drug than pharmacists? We know what drugs, we know how drugs should be marketed. I have friends that work on Wall Street, and people say, Wall Street, I don't get it. There's pharmaceutical companies there's pharmacists that have interest in finance, and there's pharmaceutical companies that have businesses that are on Wall Street. So who better to do that than a pharmacist who has an interest in finance? So there's so many different ways that I have friends that work in tech doing content creation. Who better to do content creation for a pharmacy drug than a pharmacist? So I think as we progress in the future, our minds are starting to open up more. There's more than just retail. There's more than just industry. There's more than just academia. There's so many different areas for pharmacists, which is why I'm so passionate about our profession. But if you need to screenshot this page, please do that. This book is actually free. It's online as a PDF. So please go ahead and do that. It may be a little outdated because once again, I'm not going to tell you how many years I'm removed from undergrad, but it was new then, but I think it's still very relevant. And I think I just hit the mark.
So are there any questions like this wonderful presentation? Are there any questions from our students? And you can type it in the chat box if you'd like, or unmute yourself and ask those questions.
Come on, don't all come at once now.
Well, that actually was a very, very good conversation. And see, yeah, so you teach and you do every single day. And with a passion, right? With a smile and a passion, and that's amazing. So excellent. Well, thank you very much for your assistance this evening. Again, maybe if after today you have questions, we can always get those questions to you and I can share your email with them that they'll be able to reach out to you in the future. So thank you very much.
All right, thank
Have a
you.
wonderful evening. Thanks
Thanks
so
for
much.
having me.
Very nice. So again, like I said, you might think of something a little later, anything that has to do with the field, with the profession itself. But even we'll move into the student panel portion of this evening, and then we'll also have more questions if you do have questions for a faculty member. So just keep in mind that there's always the opportunity to do that. So let's see what's going on. Anything else? Let's see. Did we miss anything? I should have had a good question to ask and I didn't, so that's my fault. I should have. But let's start now. We're getting closer to our student panel portion, and I see that a few of my students are on, and so I'm gonna switch my view so that I can see all of them, and I'll let them show their screens now, and we're going to introduce our panelists for this evening. And so we have a few P1 students, because I wanted them to kind of give you all basically their perspective on what it's like to be in this professional program now. And of course, we could have gotten P4s or P3s, but I feel like right now, you probably want to know what that transition looks like. What is it like? Because they still remember relatively what it was like as an undergrad. They should, right? It's only a year ago. So we have a few of our P1 students that are available. Let's see. I see Connie and I see Mai, but I'll call on you to introduce yourself. And so I see someone in the chat box is saying like P1, P2, P3. So just like when you're in high school, you have a freshman and a sophomore and a junior and a senior. It's very similar to your years of pharmacy school. And we're going to talk a little bit later about kind of the pathway to pharmacy school. It's 4 years. It's a 4-year program. And so when you are in your first year of pharmacy school, you are a P1, and in your second year, a P2. And then you move on to your P3 year and your P4 year, right? So every year through pharmacy school is a P1, 2, 3, or 4, okay? And then once you make it to your P4 year, you're actually a PharmD candidate. You have earned the right to say that you are a graduate, like a candidate to graduate to get your doctorate. So you are a PharmD candidate. So I see 2 students too. I see Connie and Mai, and I'll let them go ahead and introduce themselves. And so you just give us your name and where you are from and where you went to school as an undergrad. And then I'll just keep introducing everyone.
All right. Hi, my name is Connie. I went to undergrad at UT Austin, and I majored in nutrition, and I am from Katy, Texas.
Hi, my name is Mai. I am also from Houston, Texas. We actually met at undergrad, so I also went to UT Austin, but I majored in biology, just basic bio.
Nice. And I see you guys are still in the building, right? Well, just spending one of those days studying, staying on campus. Well, we're really glad to have you. Thank you. I also see Madison. Hi, Madison.
Hello, Miss Sapp. My name is Madison. I'm also P1. I am from Royce City. I did my undergrad at UT Austin as well. We seem to have a bunch of Longhorns. And I did mine in biology.
Very nice. Glad to have you this evening as well. I see Hunter. Hello, Hunter.
Hello, Miss Sapp. Are you able to hear me?
I can hear you just, yes.
Okay,
perfectly.
perfect. Okay, yes. My name's Hunter. I actually am from a small town called Montgomery. That's about an hour north of Houston, kind of by Conroe Woodlands area. And I actually did my undergrad at Lone Star in the Woodlands.
Nice. Glad to have you. And then we also have, and if I'm missing anyone that I didn't see, please go ahead and let me see your face. But I also have a faculty member too. So you're going to have faculty's perspective on the panel as well. And we have Dr. Samina Salim. And so you don't have to tell us where you went to undergrad or anything, Dr. Salim, but tell us your role here. Tell us how long you've been with the college and what is your role here at the University of Houston College of Pharmacy?
Thank you, Nikisa. Hi, everyone. My name is Samina, and I have been with the University of Houston College of Pharmacy since 2004. So it's been a while. And I teach I'm the course coordinator for a physiology course that I coordinate and teach in P1. And then I participate in several team taught courses of P1 and P3. I also have an active research program in which we are investigating the role of stress in causing behavioral impairments, so for which I also train graduate students and also PharmD students. If you're interested in getting a special problems course with me, or if you're interested in getting a research experience, you're more than welcome to come and talk to me.
Thank you very much. And while you're spotlighted, as a faculty member, what would you say, like, what would you tell students who are interested in the pharmacy profession, are interested in most specifically coming to University of Houston, because our students are unique and unlike any other student? What are some of the expectations? What do faculty members expect from incoming students to be ready for this program, to like in terms of professionalism, or in terms of communication, or in terms of, you know, maybe discipline, or, you know, motivation? What would you tell students coming in? Like, how would they be received upon coming into the program?
I think we really appreciate and we inculcate the highest degree of professionalism, because we are training future pharmacists, a future professional in the healthcare. And so the expectation, once a pharmacist is in the field, is to deliver care with the highest degree of professionalism. So therefore, our expectation is that the students that come to our college, they have the highest degree of discipline, sincerity, and professionalism. I mean, professionalism could start from a simple responding to an email in a timely manner, turning in an assignment in a timely manner, just some basic courtesy and collaboration, collegiality. All of these things go a long way. And I'm very happy to say that most of our students they display the highest cadre of discipline and professionalism, as well as courtesy and collegiality and collaboration.
Nice, thank you. So, and please, for audience members, all of our attendees, please type questions in the chat box should you have any questions that you'd like to ask for our student panel, for our faculty member. But also, I'll start to our students that are on our panel. If you can dig deep into what it was like as an undergrad, what do you feel like was maybe the biggest challenge to go from undergrad? And again, especially for those of you, like as an undergrad, like you were at a school that, you know, expectations were high. And so what has been the difference from an undergrad education moving into this professional program? How have you been able to maneuver it? And I know I hate that word, is it hard or was it hard? Of course, there's challenges, right? So what was the challenge, or maybe your biggest challenge, when you made that transition from undergrad to graduate? Or like maybe what do you wish someone had told you right before you started school, something to be aware of as you made the transition? And I'll start with you, Madison.
I would say that it was about kind of like being in a, it was kind of the studying's a lot more than what you would do in undergrad. And I feel like every time you go up to a different college, you just have to study more. They just say it's more studying. But I think one of the big things that helped, at least, was there's a lot more connectivity in pharmacy school than it is in your undergrad. Whereas like in your undergrad, you have a bunch of classes with different people, and if you might go to a different class, you might not have the same people in that class. but as we take all the exact same classes at the exact same time. And so that made studying a lot easier because you can form groups. And I would also say maybe being an adult, as I know it sounds really weird, but I know for this past year, I've had to kind of come to grips with the fact that I'm kind of more an adult now. And what does that look like, and stuff like that.
Nice. And same question for you, Hunter. Like, what would you say was the biggest challenge?
For me, it was definitely changing my study habits, because even during undergrad, I would still be taking like anywhere from 15 to 18 credit hours. But that amount of credit hours here feels like double that almost. But it's just, I definitely wish I had better study habits and knew some better, I guess, strategies coming in, because it's something that I've kind of had to adapt to these past 2 semesters. That's been the biggest thing, I think, for me, was, I guess, adjusting those study habits, and I don't know, also making time for like a school life balance, like a social balance and stuff like that. But I do agree with what Madison said. It is really nice being able to have that cohort that you're with throughout a lot of your classes, because it gives you a really good support system as well. So that was one thing that I wasn't expecting, but I do enjoy about the pharmacy school.
Nice. And I was looking at the chat box, and I see there's a question about a student who possibly might have a GED and has completed their GED and now interested in starting the pharmacy program. And so I'll actually pose that question towards Mr. Martinez or Mr. Ely. How would you answer that question if a student was asking you about, performance and what should is there any difference in the pursuit of this pharmacy education with the GED? Because again, you're still doing the college coursework, right? You're still working on college credit, and there's still the same requirements necessary. But what would you tell that student, or even to Ms. Owens, if you want to chime in as well?
Sure. So I would start with definitely the student, if they have a GED, my question would be, how long ago did you obtain that GED? If you just got your GED like 2 months ago and you want to jump into college full force, certainly you can definitely do that. But I would suggest researching perhaps a community college setting. That way you can build into making sure that you're starting at the appropriate level of courses, versus, because if you jump into a full 12 credit hours, which is what's considered a full-time college student, you want to make sure that you are easing into it at the appropriate level of courses. So for example, I wouldn't have you start out at taking Calculus 3 first off. I mean, you really want, whatever university or community college you start out with, really work closely with your academic advising team, let them know what your long-term goals are so they can help you work towards that. So all your community college and four-year universities are going to have teams are going to help you make sure that you start to have a really solid start with your college career. So that's really what I would start with. Look at your wherever you are in the country, and start from there. But definitely, whenever you're looking at our, if you know for a fact that your long-term goal is pharmacy school, and definitely tonight is a great opportunity for that, then I'm going to drop in on the chat here is a link to, let's say for different institutions that we have already gone through and isolated specifically what prerequisites at whatever school it is, to know exactly which courses are definitely going to meet our prerequisite courses. And so there's several Texas and out-of-state universities there. There's several community colleges and four-year schools. So that's a good resource right from the beginning.
Oh, thank you, Mr. Ely. And I see that there is a question about the number of prereqs when applying to the pharmacy program. And we'll answer that question, and we'll do it in our next session because you'll also hear from Mr. Ely again. And so we'll really be sure to focus on that, and it'll be in a little while. But I'd like to kind of go back to our student panel and ask Mai and Connie to walk us through a typical day. What does your day-to-day look like now that you're in the professional program, from the time you wake up to the time you go to bed. And there might be, of course, you might have the same answer since you guys are studying together. You might have the same schedule, but if not, tell us what it looks like. How does it differ? And does that, does it matter when you wake up versus when you study versus when you work out versus when you eat? So tell us how your day looks.
All right. So lately I've been having trouble planning my days out because there's so many exams going on, but I usually try to wake up early and get some studying done because our exams are usually in the mornings. And so I'll get some studying done, eat some breakfast, and then I'll head to campus and have classes. Usually on the longest class days, we have class from 8 to I think about 4:30. And so we have a lunch break between 12 to 1:30 p.m. And so during that time, I'll eat lunch with my friends and also study if we have any upcoming exams, which we normally do. And as far as like after classes, I would go home and also give myself a break. I'll probably make myself dinner. And I usually try to meal prep. That way I don't have to worry about knowing what to eat, when to eat, or making food and worrying about the time. And then what's it called? And then usually at night, I try to get some more studying done. And usually I'm pretty tired by the end of the day because we have like a long day of school and then just more studying. And yeah, and then it's the next day and it's kind of the same. And then on the weekends, I try to give myself some free time to work out, go take a walk at the park, go shopping. And I also work on the weekends, so I definitely have to time manage on that. I'll let Mai answer.
And just 1 second, how often do you work? Are you like how many hours a week or a month? How does that work with working and being in pharmacy school?
Okay, so I actually started working this semester, and within the first 3 weeks of the semester, I was working about, I want to say 15 hours a week. But then as like exams started kicking in, I only work probably about 8 to 10 hours a week.
Okay, and I know Hunter works. How many hours a week do you work, Hunter?
Typically around 16. I just work both days on the weekend, every weekend.
Okay. So and that's always a big question, is whether to work, to not work. If you're able to work or if you need to work, what does that look like, and what would be a healthy amount of hours to work? So, and we switched to you, but going back to Mai, what's your day look like, Mai? Like, is your day similar or different than how than Connie's?
So my day is kind of different just because she lives closer to campus and I commute. So I normally would have to wake up at least like 2 hours before class starting. And then like I go through the motions similar to her. And then after classes end, I usually have like extracurriculars. So I will stay back to study to avoid peak traffic hours. But when I do get stuck in traffic, I try to like kind of multitask. So I would call and catch up on friends. And that's how I kind of incorporate in like a little mental break for myself, just talking on the phone while driving. That way it doesn't really feel like a waste of time. And then I came home and I tried to have like dinner with my family and then study again. I also work, but I work less than these two. I only work on Fridays, just 8 hours a week. Usually we don't have anything on Fridays and I just go to work. But when we do have exams or co-curriculars, then I would ask them to have me off that day. And I've been very lucky because my work is very flexible with me. I also did not start working until this semester. And I know like a lot of people are not financially like stable to not work, but if you are able to, I would recommend like leaving this first semester not working if you can, or like minimize your work hours, just because the adjustment is really huge. And I did not work last semester and it was like kind of hard too. So, but if you can, then like that's also understandable too. But basically, yeah.
Nice. And I just want everyone, audience members, to know I am looking at your questions. I am seeing them. And these questions are primarily questions that we'll get through the portion of our event today a little later when we are specifically talking about admissions and submitting your application. So I'm not overlooking your questions. We're just going to answer them momentarily. Okay. So Madison, tell us about your decision to because we, have close to campus versus commuting. And so how did you come up with your decision to where you decided to stay, live versus commute, working? Does that save you more time, less time? What did you have to consider based on where you're from, based on where you decided to live at while you go through pharmacy school? And how's it been working for you?
So I live off campus. I live about 20 minutes, I would say, south of campus. I kind of moved here just because of, undergrad, family, friends. Though they're my landlords, but I don't drive, and so one of the big things that I had to worry about was taking the bus and making sure that there was a best path to get to campus. So far, I've had no issues getting to campus. I actually like it because, granted, since I don't drive, I get to study on the bus on the way to campus. It's worked so far. I like living out here. I like the separation between home and work, or home and school, where school stays at, granted, I do study at home, but school kind of stays at school. When I'm at home, it's kind of like a job type of thing. And so that's the main reason I wanted to live off campus.
Okay, thank you. So Hunter, there's a question about mental health. How do you keep it all together between studying and class and any organizations you might be involved in and working? And I know where you work at, Hunter. I see you all the time at work. So how do you juggle work and school and just keep it all together? What's your release, or how do you deal?
Yeah, it's definitely a lot. Like you said, between organizations, studying, being at school, work, maintaining a social life as well. The best thing I wish I would have known is how to manage my time better. What I found that I was doing last semester was that I wouldn't be utilizing my class time as efficiently and utilizing my weekdays as much. So what I try to do now is I try to make as good a use of my time in class and be present, not only physically, but be there mentally as well as during the weekdays, making sure that I'm staying up to date on each of my courses. So that way, when the weekend comes, I don't have as much to worry about in terms of school. And so that kind of gives me the break that I need in order to stay sane and not have to have school on my mind 24/7. And so it's kind of something where I make sure to give my weekends to myself. So yes, I do have work, but then when I get off work, the rest of that time is to myself, whether I want to do something with my friends or just want to kind of relax. And so I think it's really just making good use of your time and also having a really good support system as well. But that's something that as soon as you get into the pharmacy school, everyone's so welcoming, and like you make friends with everyone so fast that support system is something that will come. And so I think having those two things makes it definitely manageable for sure.
Yes, okay. Let's see, Connie, tell us, what is something that maybe you wish you had known prior to starting pharmacy school? Like if someone could have told you, do this or do that, or even if it's like with the amount of like how to study better, like just what's the first thing that comes to your mind when you say, what do you wish you had known? Or what was the tip you wish someone had given you before pharmacy school?
I think for me, it's time management. I think it's been really difficult for me to adjust to the workload. And I feel that I'm still in the process of, creating a plan, creating like a timeline or creating a calendar and making blocks of what I need to do each day. So I still struggle with that, but I feel like it's definitely a learning curve. You definitely learn for making mistakes and trying to follow that schedule.
And so I know, like, between working and did Madison and, like, for as far as working, did anyone who is not working in a pharmacy, because you work too, Madison, you work as well? Okay. Do you feel like, because when you see someone who, like Connie or like Hunter, who has worked in a pharmacy or is still continuing to work in a pharmacy, do you feel you are at a disadvantage because you did not have an opportunity to work in a pharmacy? Like, how has your role been at school without having the experience in a pharmacy? Like, are you dealing with it? Does it seem like it's doable, or do you wish you had had that? So,
I think it's completely doable. You know, everyone at the pharmacy or at the school comes from very different backgrounds. You'll meet a lot of people who have never worked in a pharmacy before. We have somebody in our class who this is becoming his second profession. Like, he's already gone through an entire profession and now he's going to pharmacy school. So, like, you'll meet a wide range of people, and not having gone to pharmacy school, not a disadvantage at all. You will get basically any kind of experience you need from this program. In fact, we're actually going on rotations this summer. And so don't worry about that. Make sure, I know that instead of working, I don't really have to worry about financial issues. And so I spend my time volunteering instead when I have free time, just because it makes me happy. And so if you mentally feel like you can't handle working and you're able to financially, then I would recommend working on mental health first, personally.
very nice. Okay. Hunter, tell us, like, as far as the amount of material, like, how much is it? And I always, and I might be incorrect in saying this, but I always use that, like, I think of what the chemistry final would be like as an undergraduate student. So your chemistry final, or maybe your organic final, maybe your biochemistry final. Consider the end final exam. What would that be? Test number one? Would that just be one test in pharmacy school? Like, how do you kind of say how much content is in, like, how much materials are you guys going over, and at what rate are you going over that? Does that make sense?
I think I'm catching your drift. So in terms of the amount of material, it is definitely a good bit, and it depends on the class too, because some classes might not have as much, or some classes obviously won't be as many credit hours, so you won't be in class as long, thus less material. But yes, there's typically, it's similar to undergrad where it's split up. There's either 3 or 4 tests each semester per class, and those tests do have a good chunk of material on them. And so that's why I think it's really important that you stay, like undergrad, it was something where you could kind of just cram all the material, but given the amount and the intensity of the material in pharmacy school, it's something that you definitely have to kind of keep up with, or you'll kind of get left behind, especially when you start getting into these finals that are cumulative and you're going over all that material. So I think it's just something, it goes back to study habits again, just making sure to keep up with the material, because it is a lot, but it's all stuff that will help you on later on down the road once you're a pharmacist. So it's important stuff is what I'm trying to say.
So Connie, tell us, because Hunter just, like, that was a great leeway to the next question. So the actual way that you study, is it different from undergrad? Like, how do you study for pharmacy school? You know, being a visual learner or an auditory learner, do you listen to the lectures over and over? Do you take notes? Do you look at slide presentations? Do you just read your book all day long? Tell us, like, what does studying look like for you guys?
So in undergrad, I would just cram and it would be enough. Definitely not what's happening here. I'm a visual learner, so I mainly, I pay attention in class and I took down notes as the professor goes over. And then a slide that I may like not understand right away, or I couldn't catch their information immediately, I would like take a little notes to myself to go over and like rewatch the lectures, because all of your lectures are recorded, which is very beneficial. So I would only rewatch the slides that I did not get to, because I'm not an auditory learner, but I do know my friends who would just listen and that would be enough. And then after just jotting down the notes that I missed, I just read over the PowerPoint. And what really helped me, it took me a while to realize this, but I have to study by myself first, and it varies from person to person. This is just what works for me. But then the day before is when like me and some of my friends would get together and we would just kind of quiz each other back and forth. And that really fills in a lot of the blanks that I may have from studying. And then I also use Quizlets for some of the like just straight memorizing like drug quizzes. So those very help. And then I guess the main advice I could give you guys is to give an open mind, because what works in undergrad might not be working right now because it's a completely different level. So just try your best and try different methods and see which one sticks with you the best. And the best thing is like, don't be afraid to reach out to professor and your fellows, because they're struggling too. Everyone's struggling together. So we all get it. And we like really try to help one another out. And if you want to email the professor, they're usually very fast on replying whenever they could. And that also really helps as well.
Nice. Okay, thank you. So as we wrap up this session of our student panel and faculty panel, I just want to know, Dr. Salim, what advice would you give to students who are considering the profession and the program? What would you tell them in terms of pursuit of our program? Any advice or tips, words of wisdom as they get to this point and get to where the P1 students are?
I think the students covered this really well. Once they're in the program, just paying attention to, first of all, it's going to be a different ballgame from undergrad. And so like the students said, that the preparation is totally different. There's a lot of, this is a professional program, so the expectations are different and in-depth understanding is needed. There's a lot of important stuff that's being covered, and it's a very intense material, the variety of courses. And so all of that require just being on top of your game all the time. You cannot afford to slack. I mean, once in a while we all do, right? So we have those off days and off moments, but immediately get back to it. And so just work hard, play hard. That's the philosophy. I think that has worked well for most students.
Nice, thank you very much. Well, as we wrap up student panel, and don't worry, I do see there are still some questions that didn't get answered, but we are going to continue to answer those. So before the end of this presentation this evening, before 7 o'clock, we will have answered all your questions. But please thank your student panelists and your faculty panelists. Thank you so much for spending your evening, your afternoon with us. I know you guys are still on campus, so you're studying somewhere. So thank you for your time. Thank you for your service, as always, my saplings. But if you want to type your information in the chat box, if there's your professional email that you'd like to share with the group, they can send you emails and ask questions in the future. Thank you very much. So we're transitioning now, and I will allow you all to type your emails in the chat box. We are about to do the tour, so I am going to log off of, well, you're just going to see me step away, and I'll log on to my phone so we can start the tour. And I think, Mr. Martinez, are you ready? He and I are going to tag team our tour and get started. So.
Yes, ma'am, I am ready. Can you all hear me?
I was going to say, wait, where are you, Mr. Martinez?
Yes, you're being heard.
Okay, perfect. Yes, then Mrs. Sapp, you can go ahead and meet me at our starting point, and I already have my phone set up, so we're good to go.
Excellent. Okay, so we're about to start our tour, so hopefully you're excited. Give me one moment for transition purposes.
We do appreciate everyone spending time with us today. So stay with us as we transition over. If you'll notice, Dr. Salim has dropped in her email address, and a couple other folks have done so. So if you wish to reach them offline, you're able to do so.
Hi, everyone. Okay, we are outside of our student services building, but I always begin here in the hallway of our main floor. We're located on the 3rd floor of the Health 2 building. So those of you that are familiar with University of Houston campus, we're right next to the optometry building, right next to the rec center, but we're on the 3rd floor. So I'm on the 3rd floor of Health 2. And this whole floor is occupied by the pharmacy program. And so our dean's office, our student services office is located here. So anytime you need help or support, whether from the dean's side or whether from our associate dean, when it comes to support, academic support, when it comes to admissions information, when it comes to recruiting, that's this area, that's our student services. And so I started this beautiful mural. It's a mural, it kind of gives you a timeline of what we've been doing over the last 75 years. And we're pretty proud of that. The dean will tell you that this is our diamond year celebration because we're 75 years old. We started in 1946, and that means we've had 75 years to build a really great program and an awesome untarnished reputation. So anyway, I like to show the mural because it kind of gives a timeline of events of what our program's been doing. And this is one of our large classrooms that we're going to go into. Oh, swipe to get in. Do you have your card, James? This is, you know that the building is very secure. And so everything has to be swipe access. So after 5 p.m., you swipe to get in. And here we are. So you can see this is the large lecture classroom. And typically this room is filled with students. They're sitting in here. The capacity will hold 180 students, but a typical classroom is between 120 to 125 students. So you can see it's a very large classroom, but it's not too large to where students can't hear or access the professor. And if a student has a question, they just push this little button and it's actually a microphone. So very state-of-the-art, like modernized classroom learning experience. It doesn't look intimidating. You know, there's not the stadium seating to where there's, you know, levels, big, tall levels, like when you think of, you know, like a law review area forum. So this is just very intimate affair, like even though there's 180 chairs in here, but our students, this is a very open, nice learning environment. There's windows, you know, if it's sunlight outside, you know how the weather is. There's something about sunlight that does a world of good for your mental health, right? And I say that to say our old building, there were no windows. Students didn't know if it was light, dark, cold, hot, raining, snowing outside, never know. But this classroom is very conducive to a learning environment. And so we're happy to provide that to our students. So there's a great vantage point no matter where you're sitting at in the room. You hear the professor, you can see the professor. So there's no bad spot in the classroom. As we continue to walk, we have another classroom, which is the exact mirror image or opposite of this first classroom that we went in. And the reason why that's important is because at any given time, we can have up to 3 of our pharmacy classes in the building at one time. So our P1s, the first year pharmacy class, could be taking lecture in their classroom, and the P2s could be in their classroom taking their lecture at the same time. So right there, you've got 250 students at any given time. And then there's another room that I'll show you that would be able to house another class experience. These are our wonderful students that are saying hello. And so once you leave, if the classroom, you're not in the classroom, and you heard Hunter mentioned earlier about being in class from maybe 9 a.m. till 3:30, 4:30 p.m. So if you're not in class or it's lunchtime, we don't expect you to leave the building. You're not
you're probably going to be outside of class more than you're inside of class. And so where are you when you're not in class? Well, there's a lot of open area spaces. So as you see students kind of, I'm not saying they're hanging out, they're being very productive. They look like they're studying right now, and I'm probably disturbing them, but this is an area where they're going to fellowship, commune, hang out, or study, or eat their lunch. But this is what we call it, the open area. And so on one side, you see kind of like a raised level platform. So there's a second level to it. And then there's a terrace. So right out that door or window, again, you can step outside, get some fresh air, get some sunlight. If it's too cold, step outside and warm up. It's always hot in Texas. But on one side, you've got chairs and tables and a setting here. And then on the other side, like there's this wonderful mural screen. And so again, a very visual place to be in. It's like a very visual experience while you're in the College of Pharmacy. So mural on one side, open area seating on the other side. Any of you that have been building a house in the last 5 or 6 years, you wanted an open concept design, right? You wanted natural lighting. We've got all of that in this building because this is going to be your home away from home. And also too, let's say you want to study, yes, and you need to have group sessions or you need to study on your own. And maybe there's a lot going on in the open area, chatter, students are talking. And so you want a more quiet or more intimate area to study. We have smaller classrooms. It's actually called a group study room. And so you can see students. Do you see them in there? They're waving. They're saying hi. And so again, they're studying right now. There's screens on the wall there. And so there's a QR code. You can reserve the room, group study room. And then inside, your phone can connect to the screen. So again, very modern technology. You can hook up your laptop to the screen so everything you can see is visual. You don't have to look at a smaller screen. And again, we're having all these conveniences for our students so that, again, just best learning environment opportunity possible. There is a copy room area. And so, maybe you want to print out your notes. Maybe you need to get maybe you have a presentation or something tangible and you need to either work on it. Like this is basically like an office space. And this is just for students as well. So again, printing out their notes, printing out their slides, or stapling something, just kind of like office equipment, office materials, and office needs happens in this room for our students. So between having that opportunity to print out your papers, having rooms and spaces where you want to study, because there's some other study room areas right in here. In total, I think we have 8. So there shouldn't be hardly a problem to reserve a room, especially when you're doing it with your classmates, up to like 6 students in a classroom, a study session. And so again, they're available often. So I don't think you have to be frustrated that you can't find a study room. Also too, another area that our students will utilize a lot is our kitchen area. And so that's another thing. When you are in pharmacy school, at some point you'll eat, whether breakfast, lunch, or dinner, or all 3. And so here's our kitchenette area. And so again, this is all student driven, where they keep their spaces clean. They store their food here. You've got a coffee maker, a Keurig machine, a few refrigerators, and get a load of this, 21 microwaves. It's kind of a running joke with our college, because anyone that's been so unfortunate to have been in our old building will tell you that 300 students had to share 2 microwaves. And if both microwaves are running at the same time, they would trip the wires and would short circuit, and it was just a big mess. And so now we've got 21 microwaves that are available for our students that can be going at any given time. But this is just a space, a small space for our students, because we don't want you to feel as though if you're not in class, you can't be in the building, or that you have to leave the building. You don't have to. So you can spend your entire day here from the time the building opens at 7 a.m. until the time the building closes at 10 p.m. And so again, studying in class, having student organizational meetings, having conference calls, having a webinar. Most students are typically doing something in this building. Again, more students, they're studying. We're saying hello to them. They're studying so hard. Hi, look at them. They're so excited. And you know they're studying and the exams come on Friday, but they still look happy. They still look alive. We're still taking care of them. Student in action, student in the wild. I'm not gonna bother them, it's very busy. But let's just say you don't need a study room, right? You don't wanna take up a study room when it's just you, but you do need a quiet area or a quiet space to study. We have that too. And so this is the quiet study area, which I won't talk when we go in here, but I'll just, oh, can you, yeah, I was gonna open the door. So we didn't want to disturb them in there, right? Because they were in the zone. But that is an area where individual study corrals, like you can get your own little study area. But then we have some along this hallway as well. So there's more individual study sessions. So the whole point is to let you understand that you don't have to leave the building just because you've gone outside of the classroom. You can stay, you can sit in the chairs, you can relax, you can study, you can eat. You can be in the zone, you can have meetings, as you can see right now, meetings going on. He's a very, very busy individual. And he just got inducted into PLS last night, so good job. That's Michael Tarano. He's one of my favorite students in the whole world.
Oh, I'm gonna frame that, send it to everyone that.
Okay, you can tell everyone. We're gonna go into one more classroom. And this room is also another classroom, but it doesn't look like the first classroom that we saw. It's not a lecture style classroom. More of, as you can see from the tables facing each other, they're pods. And so this is a more interactive classroom session where students will learn and work together, work on projects. But as you can see, it's in itself, there are over 100 seats available to students. There's a capacity of 120. So once again, the entire an entire class, a P1 year, a P2 or P3 year, an entire class could fit in this classroom. So as you can see, at any given time, we can have 3 whole pharmacy classes in this building on the 3rd floor alone at any given time. So again, in our old building, there could only be 1 class in the building at a time. Just because of space. And so again, students know that this is their area, this is their spot. As you have seen from this tour, we've seen pockets of students just all over the place and they're studying. And there's people at little tables, sections, areas. This is what we like to call our UHCOP Pharmacy Museum. It's really a display case of, I say artifacts, but these are all materials that were donated from previous, like just alum from years past. And obviously, if you look at the materials, you can tell that they're pretty old. But when did I tell you that we started? 1946. So this is a lot of old stuff from a long time ago, but it was donated to our program. And so we display it. Again, pharmacy is kind of like the evolution of pharmacy. Pharmacy certainly has come quite a long way from 1946, right? But again, this right here, our awards display case. So our students who have brought home national titles, one of the most unique things about our program, you've seen our students and you've heard from our students, but what you don't know is just how amazing they are as professionals. Our students, there's 25 different pharmacy student organizations that you can join or be a part of, and look at the awards that they're winning. So our national chapters, our students are a member of chapters have brought home national titles, in addition to being very active in just the local chapter by itself. And then while we haven't, just for the sake of time, we're not able to go up these stairs. However, there's a whole nother care lab up these stairs, and it's our PCCA, the Pharmacy Compounding Centers of America, donated quite a bit of money to put their name on our PCCA care lab. But that's where our students are going to learn all of their other compounding techniques. They're also going to have We have the OSCE suites up there. So that's where they're going to do like the blood pressure checkoffs and screenings, glucose monitors and checks, which is one of the tests that they had today, some of our P1s. But again, and research labs are also up there. So again, that area too, more learning environment, more classroom styles, and more of our research labs up the floor, up the stairs on the 4th floor. So that in a nutshell is our College of Pharmacy. Now, obviously, you didn't get to see the entire college, but Mr. Martinez and myself, we do tours as well, mostly on Fridays. But look on our website, perhaps starting next week, you'll be able to see dates and times of when you can sign up for an in-person come and tour with us type of tour, okay? So this was just kind of a teaser. Hopefully this was teasing you enough to get over to our building so that you want to take a tour of our college. So right now, I'm gonna turn it over to Mr. Ely, because now we're gonna answer the rest of those questions that you all had, and we're gonna talk about best practices to join our program.
Great, thank you so much. Appreciate it, Mrs. Sapp. Let me go ahead and get myself up and running real quickly. Okay. So, now, there we go. Okay, I believe that you're able to see. Okay, here we go. So, sorry about that. So, as far as a couple things, so we're going to go over in the next few minutes. Go over the requirements for our applicants. We're going to talk about the applications, the coursework, the volunteer communities, volunteer and experiences that are required, as well as a volunteer community, as well as the letters of recommendation. So, as far as applications, there are 2 applications, one of which is the PharmCAS application, which is a nationwide application that all pharmacy schools, all 140 plus in the country, are using to apply to pharmacy school. The second application is a specific application just for the University of Houston, and that supplemental application is used in-house for us. It's a very short supplemental application that also has a $100 fee associated to it, and then PharmCAS has their own fees associated with their PharmCAS applications. And then as far as moving into the prerequisite courses, at this point, I'm going to turn over to Mr. James Martinez. He is now back in his workspace, and he'll be able to walk you through our coursework.
Awesome. Thank you, Mr. Ely. So as far as prerequisite courses, we want to make sure we answer a few of the questions that were sent in the chat box earlier here. So I'll start by going over which courses we require, and then I'll get to those questions. So we do require General Biology 1 and 2. So these must be for science majors. That is very important. General Biology 1 and 2 for science majors. We also require Microbiology lecture, Genetics lecture only. And let me go back because Microbiology is lecture and lab. Microbiology is lecture and lab. And then for Genetics, lecture only. General Chemistry 1 and 2, lecture and lab. Organic Chemistry 1 and 2, lecture and lab. We also have Physics, Calculus 1, and Statistics must be required on the math and science side of coursework. Now, the first question that was asked about coursework was, do we require a degree? We do not require a bachelor's degree. I can tell you about 60% of students who apply to our program have one. So, you know, you kind of take that for what it's worth. We do see there being some benefit to having a degree, because with those additional 2 or 3 years of coursework comes the academic rigor of the upper level courses, and then also personal maturity and growth for an individual. And that's a really big part of understanding the discipline. And you heard some of our students talk about learning how to study and learning how to prepare to be a student. And a lot of times we see that a little bit more maturity and growth in some of those students with a bachelor's degree, just because of those additional years of lived experience. So the degree is not required, but again, there are certainly some benefits to it. The degree will also exempt you from 9 of the 10 core curriculum courses that you see on the right-hand side of your screen. So 9 of those 10 are English 1 and 2, History 1 and 2, 2 governments, language, philosophy, and culture, what we call a component area option, which varies by each school that you attend, and then also creative arts. So those can be exempt if you have a bachelor's degree, especially if you're out of state. They may follow a different core curriculum than the state of Texas. So if you have the bachelor's degree, you will be exempt from 9 of those 10 courses. The one exception is we do require intro to psychology or intro to sociology, regardless of whether or not you have a degree. So intro to psych or intro to sociology is required, period. So hopefully that answers some of those questions about how many courses we require. It's 20 or 21, depending on your physics status. So in regards to physics, we do accept 1 year of high school physics. So we do accept 1 year of high school physics to meet that requirement. And then I think we're ready for the next slide, Mr. Ely. So going from coursework, let's talk a little bit about the volunteer hours, work experience, things like that are required for our program. So at a minimum, we do require 25 hours of volunteer service. That is 25 hours of community service. It's unpaid, right? Not necessarily part of your job. Now, maybe your job has some volunteer opportunities that will count, but only count the ones that are unpaid, okay? So 25 hours of volunteer service. Mr. Ely always tells students, don't be a secret agent. And what does that mean? That means share all of your information with us. Let us know about your work experience. Let us know what community work, what groups and organizations you're involved in, okay? The more we know about you as an applicant, the more the admissions committee can use to make a well-informed decision when reviewing your application. So work experience. There's an area on your application for work experience. It's also broken down into pharmacy experience. So if you've worked as a pharm tech, if you have experience shadowing, research opportunities, you want to make sure that you include all of these areas in your application. There's also an area for health related. So sometimes we will have students who are coming over from being a nursing major, pre-med, whatever it might be. If you have that experience, we will accept it, okay? Those volunteer hours will still count towards and benefit your application. So provide it. Again, so any shadowing or research experience, additional health areas, let us know. Any extracurriculars, all right? So clubs and organizations that you're involved with on your college campus or in your community, those are beneficial to you. It adds depth to the application. And same thing for awards and recognition. We want to know, were you on the dean's list? You know, are you an Eagle Scout? Whatever it might be, you know, what scholarships did you receive? We want to know that information so that we can provide that to the admissions committee. The last thing that I'll mention on this slide here is pharmacyforme.org. So for students who are maybe unsure of what the field of pharmacy can provide them or what kind of career paths and what opportunities there are, pharmacyforme.org is a great website to get started and just kind of looking at what opportunities are out there for you so that you can use that as a launching point to different career areas within the field of pharmacy.
Excellent. So I'm going to take it over and discuss more about letters of recognition. So we do require 3 letters of reference from appropriate sources here in the United States. The people that can write that letter of reference on your behalf could be a licensed pharmacist here in the United States. It could be a college professor or teaching assistant or an academic advisor here in the United States. It can also be an employer, like your boss in a work setting, or even the volunteer supervisor if in a volunteer setting. So, and again, these are people that have written as far as work or volunteerism, or even this is all college within your college years. So nothing that you did way back when you were a teenager in high school, but really from the college years and beyond. As far as you cannot use any close friends or family members to write this letter of reference. If you've got some folks that in your family that are pharmacists, for example, use them to introduce you to other pharmacists that are their colleagues that can write letters on your behalf, because you really want to make sure that there is it's coming from a professional standpoint, that you want to make sure that it's above reproach and these people are writing your letter of reference so that it's going to be objective, so it's an objective source. And when you're choosing this person, make sure that it's going to be someone that can really speak to your abilities, whether it be academic from the college standpoint, or or if you're volunteer or service, or even your skills and abilities from a work setting. So really keep that stuff in mind. And also, when it comes to this person who's writing this letter of reference, you want to give them adequate time to really write you a strong letter of reference. So if the deadline is on Monday, don't ask them the Friday before to write you a quality letter. You want to give them time for that. And you may have heard the old adage that it's not what you know, but it's who you know. In this case, that's not true. It's not who you know, but who knows you and how well they know you. So from the standpoint of if you're asking a college professor, make sure that they're someone that, make sure that you're doing the part so that they would feel comfortable writing you a strong letter of reference. So in the college setting, make sure that you are attentive in class, you're punctual, you're presentable, make sure that you're well prepared for those classes. And then you make time to get to know the professor so they can also in turn get to know you. So active class participation, utilizing those online student portals for online quizzes and stuff. Those professors are going to see if you're logging into their portal and utilizing the resources that they make available for you. So, and also keep in contact with that professor after the course ends, so that they can, let them know how well you're progressing a year or two, a semester or two, so that they can keep remembering you. So they can know who you are. So that's very, very important. Something else, when you ask for that strong letter of reference, make sure that they can feel comfortable writing that for you. You want to provide them and give them, like I said earlier, give them a deadline that's well ahead of time before it's due, and follow up with, gentle email reminders that they can ask you. That way they can asking them to get that submitted well before when you need it. As far as when you're asking that person to write you that letter of reference, provide a resume, give them your work history, a CV, so that they can, have some things they can pull from as far as pull from when they're trying to write up your letter of reference. So give them some pieces to work with, because they may not recall promotions or recognition or some of the experiences that you had when you were with them. So what I'm going to do now real quickly is I'm going to shift gears and share my screen to show you a couple of examples of what a letter of reference looks like. So here we go. One moment here. There we are. Okay. Excellent. So right now, what you're seeing here, this is a letter of reference. This is the actual letter of reference form that's a standardized form that's provided by PharmCAS. So this is something that PharmCAS is going to, ask them, how long they've known you as a person. They're in what capacity they've known you. In this case, in this example, the person knew him as a supervisor. You see they're actually supposed to rate applicants within these various different capacities. So make sure that the person writing that letter of reference for you knows can speak on these areas and can rate you. And this person, they gave them a high rated, recommended them highly. So that's one piece that's required. Now, as far as this person chose to include an actual letter of reference. So in here, you see that this person mentioned that they knew them as an employer. So in green, I pointed out where the person first started the job with their initial position, and then they actually rehired them the next year for a position that had a higher level of responsibility. In yellow, you see what the recommender is giving specific examples about what the person's role was, as well as how well this person performed in here. So I'm not going to go through each and every one of these items, but you do see that the person writing this letter of reference gave some specific information about how well this person performed within various levels of complexity within their roles. So this could be someone who volunteers or it could be an employer, but you can really see that this is really helpful and not just, it's a highly recommend, but they also provide some really solid detail for the admissions committee to help see an applicant beyond just the grades and scores. So here's another letter of reference, and this is from a professor. The person's known them 1 to 2 years, and their overall rating was that they recommend the applicant, but this professor didn't rate them, only rated them on 2 of the individual areas. So and that's all that Professor Woodrow provided. So you really want to make sure that you're having, again, whoever's writing out that letter of reference, you want to make sure that you give them enough time and information so they can write you a strong letter of reference that they're comfortable with. But I mean, between these 2 letters of reference, who would you like writing your letter of reference? Carol Danvers, who's provided a lot of detail, or Professor Woodrow? Because this is the type of information, these are the type of sources that you want to make sure you're aware of when you're getting your application ready to submit to the College of Pharmacy. So we spent a good amount of time through that, but I want to, and I hope that's been helpful to you. But I also want to go ahead and open up to some questions you all may have at this point.
Yeah, so feel free to either unmute or use the chat box if you have any questions. We are very happy to answer all of those right now. I know there was a few in the chat box earlier, and I believe we covered all of them, but if we did not, please let us know. So is there a limit to how many pharmacy schools or programs a student can apply to? There is no limit. You can apply to as many as you would prefer. Just know that there is there's an application fee for each school that you apply to.
And something else for that is, as you're preparing to apply to multiple pharmacy schools, they all have different requirements. So make sure that whenever you're taking classes, you make sure that you take our required courses, and so that way you don't get to the point now where applicants are scrambling at the last minute trying to complete classes and they just don't have time to get it done.
Can the PharmD prereqs be taken anywhere? Does it need to be the same school as the PharmD schools? You can take the prereqs pretty much wherever you would like. Just make sure they're an accredited institution. If you have questions as to whether or not they are or are not an accredited institution, let me know.